Welcome back, everyone. Today we're talking about thyroid issues, things that we can look for. Maybe we have it, maybe we don't. We have our guest today. This is Dr. Andrew Petersen from Holtorf Medical. You know, thyroid issues are something that, how do you self-diagnose yourself on that?
Sure, and thanks for having me. It's great to be here. The thing about the thyroid is if you pay attention to your symptoms, you can self-diagnose yourself to the extent that you can say, I feel tired. I feel sluggish. My brain is not working as fast as it ought to be working. My skin's dry. My hair is getting thinner. I can't lose weight. What's going on? Well, if you pay attention to those symptoms, you can tell, I have a thyroid problem. The problem with this is a lot of doctors will say that it's depression.
It's misdiagnosed.
That's right.
All the time.
Well, it seems like it lumps into a lot of other categories. It could be this or this or this.
Exactly. I mean, think of those symptoms. I'm tired. My brain's not working that well. I can't lose weight, which means I'm not very happy. That's very commonly misdiagnosed as depression.
Could that also be menopause? Could that also be...
Sure, there's other hormones involved in your thyroid. All of your hormones are in a concert together. So if you're having a thyroid problem, you may also be having an insulin problem, you may be having an adrenal problem, your estrogen, your progesterone, all of those things play into the hormonal balance in your body.
What is the thyroid and how does it impact all of those things?
Right. The thyroid's a gland in your neck. It produces a hormone that we call it thyroid hormone. I mean, the fancy name is thyroxine and triiodothyronine. That hormone goes to every cell in your body, and it controls the metabolism of every cell. So if you have enough thyroid hormone, everything functions at the rate it's supposed to. But if it's low, everything slows down.
What happens if you don't have this treated and you have it?
Well, it can be very dangerous. Now, of course, obviously, if you don't have it treated, you're going to feel tired and your life's not as happy as it ought to be. You're sluggish and just can't participate in life well. But I think more frightening is your cholesterol will go up, you'll get osteoporosis, you may have problems with infertility. I think probably the most alarming is heart disease. Women, if they have a thyroid problem, they're twice as likely to have a heart attack. There's 30,000 heart attacks in America that happen every year that are completely preventable.
So does the thyroid work for years and years and then just stop, or what happens when you develop problems like this?
I don't want to say it depends, but it depends. As we age, all of our hormone production goes down. But another thing that's very important is multiple pregnancies. They can wreak havoc on a woman's hormones. Any type of stress, and your body doesn't say, oh, that's physical stress, that's emotional stress, that's nutrition.
It can't distinguish?
Yeah, stress is stress to your body. And so if your diet isn't as healthy as it could be, that's nutritional stress. If you're worried that you're going to lose your job, that's emotional stress. If you had surgery on your knee last year, that's physical stress. And all of those things are going to cause your thyroid to not function as well.
So once you go in and you get diagnosed that you definitely, this is the problem, do you feel better right away with treatments?
You can. If the treatment is correct, if they're giving you the appropriate active hormones, then yeah, you can feel better.
Is that
quite
all
quickly.
it is? Is it a matter of adjusting your hormones?
Yes and no. There are things that you can do to improve your body's ability to make the thyroid hormone as well.
Like what?
Well, iodine. Thyroid hormone, the primary thing that your body needs to make it is iodine. So you have to make sure you're getting enough iodine. People that are low in that, they'll all be low thyroid. But there are two types of hormone. Thyroid hormone, there's an inactive and there's an active thyroid hormone. If you can't turn the inactive into the active hormone, it's still not going to make any difference for you. So to do that, you have to have selenium and zinc. And so nutrition makes a difference in this.
Does this happen to women more than men?
It does. For two reasons. Number one, women have more problems with autoimmune diseases, and that's really technical, and I don't want to confuse the listeners, but if your immune system attacks your thyroid, eventually your thyroid burns out. That's far more common in women. But more importantly, women have fewer thyroid receptors in their body than men do, and so a smaller decrease in their level of thyroid causes a more obvious symptom.
So at what point do you say, it's just, I have the flu, I'm tired, and at what point do you go in? And it's just, when it gets overwhelming?
Right. I think if you pay attention to your body and you say, something's not right, and you keep being told, no, it's just that you're getting older, you need to make sure that the appropriate tests are being done. I think you should go in and see because, like I said, if it's simply that you don't feel well, maybe you want to be patient with that. I don't think you should, but what about the risk of heart disease? What about the risk of osteoporosis? So having it correctly checked is important.
Well, and as women, we put it off. We take care of everyone else first.
Yeah.
So that's a
No,
good
that's absolutely
reminder
true.
we need to go into.
Yeah.
You are located in Provo.
That's right.
And if you want more information, we'll put the website there on ours. Such great questions. I wish we had more time. You can contact Dr. Andrew Petersen at, is it Holtorf Med?
Holtorf Med.
Is the website.
They can also look at hmgutah.com.
All right, we'll put all of that on ours with a link. So go to cw30.com/Daily Dish. Thank you for
Thank you
being here.
so much.
That's great.
Up next, winter running can be fun and beautiful as long as you have the right gear. And we have Jess Perry here to help us get started on that.